Oh, Harika. Hello. Good evening, everyone. Good evening. Good evening. Hi. I'm Chaitra Nanjanda, wellness coach from Daily Bloom IBS. Hello. I'm Sanya Nasim Vivek Shukla. Hello. Hi. So every Saturday, our team of nutritionists and mental health practitioners, we take turns to we take turns to present various topics on IBS management. And we invite you to join us as we foster this community of support and care. We'll just wait a couple more minutes for the interested participants to join. Ramesh, Ramesh, good evening, Ramesh. Hello. Sanya, yes, you are visible, and I'm not able to see because the screen is casted, but I do see the participants. Hello, Sanya ji. Hello, Ellen. Good evening. Just a couple more minutes, and we will start off exactly at 5:05. Sure. Anybody has any queries or you want me to stop in between the webinar, please leave a chat down. I can access it and answer your questions. Although at the end of webinar, we do open the forum for everybody's queries. All right, so I think we have about 13 participants now. Um, so today's topic, as you all can see, we're talking about the IBS and the role of neurotransmitters. So before I go ahead and present on what I've prepared for, I'll just keep the chat box open. Okay. Why did I decide to present on this topic? One question we often get asked as practitioners is why is mental wellness even a vital role in something to do with digestive issue, right? As we all know, IBS is a gastrointestinal or functional disorder related to more to do with your stomach or gut. So why we often get asked, why is the mental wellness important here? Um, if you all are part of our program, you would have been introduced to what is GBA, that is the gut brain axis. And in that gut brain axis, we learn that it is a bi-directional system. Your brain and your gut, in simple words, it communicates with each other and impacts each other's functioning. With the brain comes neurotransmitters and the role of neurotransmitters, and that is why the topic. And by the end of this webinar, I'm sure you'll find your answers as to why mental wellness is important for your IBS management. So let's get started. So in the webinar, we will be looking into the introduction of IBS and what are its symptoms. We'll have an overview of what are neurotransmitters and what role does it play in the brain function. What is gut-brain axis and how the neurotransmitters influence the gut health. What are the neurotransmitters? Like there are a number of neurotransmitters and what role do they play? And if there is an imbalance in the neurotransmitters in the body, how is it connected to our IBS syndrome? Right. And I will continue to explain each neurotransmitters and how we can improve it in our body. And at last, we will see the treatment strategies which can target neurotransmitter imbalance. Let's get started. Understanding IBS. So definition, what is IBS? It is a functional gastrointestinal disorder. It is characterized by recurrent, that is over a week, like twice a week or thrice a week, abdominal pain or discomfort, gas, bloating, and altered bowel movement, as you all know, either constipation, diarrhea, or both forms. It could be characterized by these symptoms. Impact, oh, just a minute. I don't know if you all can see this. Okay. Impact, it affects up to 10 to 15% of the global population worldwide, significantly impacting the quality of life. So one other statement I do inform my patients is not to worry and not to feel that they are alone in this condition. It is more common than we think, and if the taboo was not surrounded with the digestive system and any healthcare diagnosis, more and more people would be diagnosed with it. But it's just people don't reach out for help because they see it as just diarrhea or constipation. As of today, it stands at 10 to 15% of the global population are affected by IBS. Symptoms include, like I said, abdominal pain, bloating, diarrhea, or constipation. Um, Moving on. Right. So what are neurotransmitters and what is their function in IBS? Neurotrans One observation image is for IBD, as we know, IBS and IBD. Oh, okay. Khalil, sir, I'm so sorry, I didn't pay attention to the image. But yes, IBS. Um, So neurotransmitters are often referred to as the body's chemical messengers. They are the molecules used by the nervous system to transmit messages between neurons, from neurons to muscles, right? So if I have to put it in layman's term, what are neurotransmitters? It is basically, let's imagine two phones. How do you connect between the phones? It's the signals that passes calls or messages from one person to other person, right? So you can consider neurotransmitters are like the signals or the small particles in our body that sends messages from brain to all the other parts of the body and from the parts of the body back to our brain. All right. So the brain needs neurotransmitters to regulate many necessary functions, including the heart rate, breathing, sleep cycles, digestion, mood, concentration, appetite, muscle movement. So any form of small or major functions of the body, neurotransmitters are required to and send the information from the brain to the other part and back forth. Uh, Going on, neurotransmitters and gut health. Uh, Not able to move. So impact of neurotransmitters on gut health. What happens if the neurotransmitters get imbalanced in the body is it can disrupt the gut function and contribute to gastrointestinal conditions like IBS, right? It leads to altered gut motility. What is gut motility? Very simply speaking, it is the movement of the food from the time you swallow till it passes out of your body. So the movement of that food throughout your body is known as gut motility. Visceral hypersensitivity is nothing but if your neurotransmitters are imbalanced, even the littlest of pain, you're too sensitive towards it, and you feel like it is worse than actually it is. That is, you're hypersensitive to any symptoms. And abnormal secretion patterns, that is your bowel movements, like diarrhea, like 6 to 7 times a day, is considered not a normal excretory times, right? So pattern. Restoring the balance of neurotransmitters is one of the key targets for treating IBS symptoms. And this is where neurotransmitters, IBS, and mental wellness comes into picture, right? What are the neurotransmitters that are involved in gut health, and how can we what can we do to improve that? Neurotransmitters such as serotonin 1, dopamine, acetylcholine, and GABA. These are the key regulators for gut motility. Okay. So how can we manage this? Let me try and explain it to you all. What are the functions of these particular neurotransmitters in your gut? Serotonin, that is um, in your entire body, whatever the whole amount of serotonin, 95% of that serotonin is present in your gut alone, right? So serotonin is responsible for regulating intestinal motility. Like I said, that is nothing but movement of the food in your intestines. Secretion and sensation. That is, if your serotonins are abnormal, you start feeling the bloating as very severe, or you start, for somebody who has a good serotonin level, they might not feel as strongly as somebody who has less serotonin in the body. It influences peristalsis. What is peristalsis? It is the muscle contraction of from the food moved through the digestive system, right? Digestive tract. And alteration in the serotonin levels or receptor sensitivity can lead to conditions like constipation, diarrhea, seen in the disorders such as IBS, right? So what happens if the serotonin is low in your body is the movement of the food in your digestive tract can be little constricted in case of constipation, or very fluid in case of diarrhea. That is one of the example. How can you boost serotonin naturally? So here is where you see with every neurotransmitter, one of the key areas you can work to increase them in your body is paying attention to your physical and mental wellness. Here comes exercising regularly, mindfulness and meditation practice, good sleep hygiene, diet and supplements, of course, light therapy, and enjoyable activities, right? Um, Now you understand why weekly there is a call, and every week you've been introduced to some or the other relaxation or yoga and meditation videos. Moving on to the second neurotransmitter, much like serotonin, there is another neurotransmitter known as acetylcholine. This also stimulates the gut smooth muscle contraction and enhances the gastrointestinal motility. Very similar. Its action is crucial for proper digestion and the movement of the food through your intestines. Along with its role in motility, the acetylcholine stimulates the release of digestive enzymes and increases the secretion from glands in the gut, aiding in the breakdown of the food. That is, acetylcholine is important in basically breaking down the molecules of the food that you're eating into smaller or better consistency to pass it through the motility to your intestines. Um, Sorry, I thought I saw a question. No, okay. and one zinc-rich food, magnesium-rich food, manganese-rich food, turmeric. Second image there is mindfulness, basically. Moving on, what other neurotransmitters are there? One of that is one other would be dopamine. So dopamine is especially associated with brain's reward system. What is that? Basically, when you get excited, dopamine is released. When you're happy, dopamine hormone is released. It's a reward system of your brain that dopamine is like a hormone or a prize given from your brain every time you feel happy, right? And it also plays a role in regulating the gut motility, just like acetylcholine and serotonin. Abnormalities in dopamine signaling can affect the gut transit time and contribute to gastrointestinal disorders. Transit time is, like we previously said, you might feel the urge to excrete any time of the day because of your mood irregularities or abnormalities in your dopamine. How to increase dopamine naturally? Again, your first is consuming probiotics. Second, eating protein-rich food. Getting good sleep. Third, avoiding high-fat diets. Exercising regularly. Practicing meditation, listening to music, or doing any enjoyable activities for that. Spending some time in the sun, yes, and following a healthy diet, right? Uh, Fourth one we're going to discuss is the GABA, that is gamma aminobutyric acid, neurotransmitters and gut barrier function. So where GABA plays a crucial role is maintaining the integrity of the lining and intestinal lining, and it prevents the passage of harmful substances into bloodstream, right? So GABA is a inhibitory neurotransmitter which helps again gut barrier function by regulating the permeability of intestinal epithelium. That is, it basically puts like a lining over your intestine innards so that the any harmful substances that you do consume, it does not let it enter the bloodstream. Okay, and it just passes it through the intestine and keeps you away from harmful side effects. It reduces inflammation and protects against damage to gut lining. Inflammation, the what we're talking about here is muscle inflammations or bloating. It could be any kind of you know um, increasing of the size inside your intestines. How to increase GABA levels? First one, again, as you see in the picture, it is exercising regularly. Yoga, meditation is a must, while keeping in mind what are the rich in calcium and rich in GABA, glutamic acid food. So protein, fermented yogurt, oranges, citrus fruit, walnuts, all of these. So navigating treatment options, yes, it is very tricky when it comes to neurotransmitters because it often goes undetected in any tests. Even the blood test, it cannot give you an exact estimation of how the levels are, the hormonal levels in your body, not an exact one, but there has been more studies coming up into giving the estimate of dopamine and serotonin levels in the body One of which Daily Bloom, with all of our professionals, we are trying to provide is dietary modification, like you saw. All of these hormones, neurotransmitters that are important for your gut motility, comes with good nourishment along with healthy practices, which is why you have a team of nutritionists and wellness coaches who are throughout your program guiding you to better manage your IBS symptoms. Uh, so that is about it. I'll open the floor for any questions anybody might have regarding our webinar today. Any questions? Any supplements? Yes, in like I said, if it is detected in your blood, see, often, like I said, it goes undetected, but more stronger hormones like dopamine, serotonin, GABA, these do have a good detection in the test done, that is blood test or lipid test, right? And if there is a dire need or there is a extreme deficiency in the body for hormones, supplements are available. But if it's a borderline case or it is still in a normal case but not very effective on you, not all doctors would go ahead and prescribe supplements. They would ask you and advise you to change your lifestyle and your food habits to, kind of boost it naturally in the body, or else you would have to rely on the supplements lifelong, which could be little, on a cost effective, not very cost effective for you. And the practices that have been mentioned to boost it in the body are very, how do you say, healthy. I would say very good session. I just want to know what could be minimum time for meditation to increase all these neurotransmitters. Ideally, yeah, we would see, it is suggested at least 30 minutes or 45 minutes in a day. Not just meditation, any form of exercises, 45 minutes in a day is a must. If you're only talking about preferred meditation, I would say increase your endurance or duration to 12 minutes, 15 minutes. You should be able to be comfortable with your own mind and thoughts. So that would be healthy. But if you're somebody who cannot have that silence and, meditate, I would say go ahead with our guided meditation audio clip that we have on our app, or we also have our yoga, videos that we often share. Please ask us about it, and all the coaches would be up in front to share it with you all. But yes, 45 minutes overall, all the exercises and meditation included. I hope that answers you, Dr. Manoj. Any more questions? Also, please know that every Saturday, both our nutritionists and sir, both nutritionists and wellness coaches pick on topics that could help you with, information on IBS management. Every Saturday at 5, you will be getting links from our team to join us. Could you please share us the PPT slides if possible? I'll get back to you on that, sir. I'll ask the team if it is possible and we'll do the needful. Anybody has any more questions, please do feel free to ask. Thank you so much. It was a great. Thank you so much. Thank you for patiently and attentively listening to me. And I'm sorry about the interruption caused due to the power cuts at home. I hope this session, this webinar answered the dire question that everybody has. Why is wellness such an important, why does it play such an important role in, gut related condition? And this is the answer why, because it's a bidirectional, disorder where your gut and your brain is always connected with each other. Any more questions? We have another 2 minutes before we end the live session. So please feel free to ask. All right. I think thank you so much, everyone, for joining us. And please feel welcome to join us every week and connect with all of your coaches. Ask us your doubts, and we'll do our best to answer your concerns. Thank you so much. It was a wonderful session. Yes, thank you.